Hello, this is Dr. Brian McDonough, and welcome to the new normal. I'm actually following up a report I did a couple days ago about multisystem inflammatory syndrome in children. It's May 15th, and I mentioned a couple days ago we're going to learn things fast, and in fact, we are. And what we're learning is what the CDC has just guided us with. There were cases that we discovered about April 26th in the UK, and then it was noticed that kids in New York and the New York area were having problems. Over 100 children, 3 of them died, and they had this constellation of symptoms that reminded physicians of this rare condition called Kawasaki disease, which affects 1 in 10,000 children and usually attacks between the ages of 1 and 5, and it's usually a wintertime disease. Well, this form or this variant of COVID where something is going out of control can attack while a child has COVID or after a child's gotten over COVID. So because symptoms are not always dramatic in children, you may not even know your child had been exposed. But the symptoms are quite classic, but there are things you'd be frightened of. A persistent fever that's not responding to medication. The blood pressure can drop. I mean, the child just feels very lethargic and weak, like the pressure is low. If we were to examine and do lab work, which if we saw the child we would, there's elevated inflammatory markers, which are studies we see. But there's also multi-organ involvement. It can affect the kidneys. It can affect the brain. It can affect the skin with this like really dramatic rash. It can affect the heart, the GI tract, and all of these things are concerns. And ultimately, one of the bigger concerns, of course, with COVID, we see it is the respiratory issues. Children can be struggling to breathe. Now, the reason why I bring it up, and the reason why I'm talking about it dramatically in the new normal is because it is something that you have to get to fast to help your children. If they're treated, they seem to do well, but if they don't get in quick enough, they can really go down fast. So I think it's a really important thing we talk about. And also it serves as kind of a stirring reminder that COVID-19 just doesn't attack the elderly or people with pre-existing conditions. Sadly, it's attacking other age groups, and it's a concern. So I just want to bring it out there so you're aware. And obviously, the more we learn about it, the more we'll deal with it and talk about it.